and then to the plastinated. Okay, Bismillah.
Male.
Yes, Salam. Very good.
Yes.
You get my question. you didn't let me speak. Huh? Male pelvis.
Yes.
Female pelvis.
Yes.
Awalan. Yes. And yes, pubic arch. Okay. Now, what are the structures here? I can see.
Pubic one.
What are the structures here? I can see. Okay, this is a bony pelvis. The shape is not like this. The position is not like this. The position is actually like this.
Yes.
Why? The anterior superior iliac spine and pubic tubercle should be in this, like straight plane. There is a straight plane. So they should be like this. This is how it is placed anatomically. Then, for understanding purposes, yes. Now we have two ilium bones, hip bones here. Iliac part, pubic part, and the ischial part. This is known as, okay, let's describe some features of the bony pelvis. Some points. Anterior superior iliac spine.
Yes.
Anterior inferior iliac spine. Okay? Then pubic tubercle. Anterior, so we have posterior superior iliac spine, posterior inferior iliac spine. And then we have ischial tuberosity. Before that we have greater sciatic notch, lesser sciatic notch. मिल गया? लेके आओ उधर किसी कबर्ड में देखो. एक कार्टन है उसमें होगा. Greater sciatic notch, I'm sorry. Greater sciatic notch, lesser sciatic notch. Okay? Then acetabulum for making hip joint. Obturator foramen. Ischio pubic ramus. Pubic ramus. Ischio pubic ramus, combined ramus. Because half is ramus of ischium, half is ramus of pubis. But here we have only pubic ramus. Okay? Pubic tubercle. From anterior superior iliac spine to the pubic tubercle, we have inguinal ligament. Okay?
Okay.
What are the joints available here? Symphysis pubis, secondary cartilaginous joint. Then we have lumbar discs and lumbar vertebrae. No problem. This is known as promontory. This is promontory of sacrum. Promontory of sacrum. This structure.
Yes.
Promontory of the sacrum. Okay. Now, what is the line of the pelvic inlet? Here.
Arcuate line.
Yes, arcuate line. Here. Pelvic inlet. Iliopectineal line. It has two different names. You can separate them, or collectively you can say iliopectineal. I didn't write it in my slides, iliopectineal. But it is actually another name is iliopectineal line. Here is promontory. This is Ella of the sacrum. This is Ella of the sacrum. Okay, this is promontory. This is lumbar 5 vertebra will make joint here in intervertebral disc. Okay. After this, pelvic greater pelvis. Before this, yani. Inside pelvic cavity, this is pelvic outlet. Pelvic outlet is composed of, like here, symphysis pubis, coccyx, ischial tuberosities here, and pubic arch. Okay. Now, with the ligaments, what are the ligaments? You will see here. Sacrotuberous, sacrospinous. Now, here it is known as greater sciatic notch, lesser sciatic notch. Now, with the help of sacrotuberous and sacrospinous ligament, they are foramen. Greater sciatic foramen, lesser sciatic foramen. Good? There are other ligaments, for example, like anterior longitudinal ligament, inguinal ligament. Okay. Anything here? See the pelvic outlet. Where is the pelvic outlet? Symphysis pubis. Tip of the coccyx. Ischial tuberosities. Sacrotuberous ligament. Pubic arch. This is the pelvic outlet. What is pelvic inlet? A plane, a brim, which is bounded by symphysis pubis, promontory, iliopectineal line. You can have two different names. Understanding?
Yes.
Good.
Where is the true and false?
Okay, after this, think of a plane. When I say plane, it means an area here. This is a plane. So above this, false pelvis. Below this, true pelvis and pelvis cavity. This cavity. Okay? Now understand?
Yes.
But don't think in anatomy we do have any such structure. No, we don't have. This is just an imaginary plane here. Okay. Pelvic diaphragm, where it is located, like this. Here it is located. This is the location of pelvic diaphragm. This is the model showing you the genitals and perineal area also. What is perineum? Perineum is the area between the thighs. It's a diamond-shaped space which includes our genitalia. So this is how it looks like. Perineum is not with us today. We can remove the genitals and show you the area between the pelvic diaphragm and below. So anything below the pelvic diaphragm is perineum. Now, this is like pelvic diaphragm. This is the anatomical position. Okay. It is incomplete. They say it is incomplete in front for the passage of genital and urinary tracts. Then it has two big muscles. This different color, this different color, but still this all is one muscle. It has different type of fibers, anterior fibers, lateral. This is levator ani muscle, and this is coccygeus. See, levator ani and coccygeus. Okay. Now, if I place it here, levator ani and coccygeus, then I should see another muscle. Remove this. I should see another muscle here. Obturator internus. Obturator internus. Here is obturator foramen. Obturator foramen. Okay. Now clear?
Yes.
Okay. About the sacrum, very quickly, let's deal with the sacrum. Here is the anatomical position is like this. Okay. Promontory, apex. This is base of the, because it's a triangular base, apex. This is the coccyx without. This is sacrum without coccyx. Here also we have coccyx. Okay, so this is the base. Probably this is. Then we have anterior aspect, posterior aspect. In the anterior aspect, we have anterior foramina, anterior sacral foramina, posterior sacral foramina, vertebral canal, hiatus. Okay. Here we have median sacral, then we have intermediate, and then we have lateral sacral lamina. Thank you very much. Thank you. The coccyx in male and sacrum in male is like inverted, and in females it's like everted more. The cavity of a female pelvis, the pelvic brim, you know the theoretical differences. The brim is more. Here we have smaller brim, or heart-shaped or triangular shaped. Here it is oval and transverse. The cavity is very roomy. It's vasa. It's very spacious. In females, in males, no. The ischial spines, the coccyx, they are everted in females. They are sort of inverted in males. See how inverted is the coccyx and sacrum. Okay. Then I will show you here some plastics first. What you will find here, what are the structures you can see? Here, urinary bladder, prostate. This is urogenital diaphragm. No, urogenital diaphragm is below. Why I am saying there is no, this is a part of levator ani, like here and like here. It is not in the midline. Understand? So here, this is known as urogenital diaphragm. Then we have bulb of the penis and other structures. This is symphysis pubis. Okay. Here, what are the structures available? Here you can see levator ani. Good. Here you can see levator ani, symphysis pubis. In females, if you remove the viscera. I have shown you this picture. Where is symphysis pubis? Here, wala here. Think of the rectum. So symphysis pubis, urethra, vagina, rectum, all levator and eye. Coccygeus should be here. This is part of obturator internus with the hip bone. See obturator foramen, obturator internus. Obturator foramen. Obturator foramen is covered with obturator membrane. On the inside we have obturator internus. On the outside we have obturator externus. Just connect it. Okay. 4 cadaverics. Okay. Don't open it. Fix it on. It's out. Okay, later. Okay. This is the cuts, median section, showing you rectum in a male specimen. Please see here. Rectum, anal canal. See here. Levator and eye, coccygeus, obturator foramen. Good? Obturator nerve.
Just nerve?
Obturator nerve, at least in this specimen. Here, piriformis muscle is here on the back.
How to identify?
It's covered with this plexus, sacral, lumbosacral plexus. So this is actually covered with. So here levator and eye, here on the back coccygeus. Okay. See here. I can see.
The levator and eye.
Yes, levator and eye all here. I can see a very good white line. See here. White line. Visible?
Yes.
Please. Here. Okay. Obturator internus. Here on the back we have coccygeus. This is rectum. This is vaginal opening, urethra, and etc.
Can you point at coccygeus?
Here. Coccygeus.
Coccygeus.
Here on the back. Obturator internus here. Obturator internus.
Where's the cell? Coccygeus.
On the back.
Piriformis.
Here on the side.
Piriformis on the side.
Okay. Obturator foramen. Obturator foramen. Good?
Good.
Inguinal ligament. Symphysis pubis. Understand?
That's not clear.
Good. What?
Levator and eye.
Good.
Coccygeus.
Coccygeus.
Obturator.
Internus.
Internus.
Obturator internus. And
On the side there is
piriformis. Now clear?
Can I see the piriformis?
Yes, this is piriformis.
between the flexus of the.
Yes, on the
Can you
back.
repeat it, sorry, because I didn't see.
Okay. Levator and eye.
Okay.
Good. Obturator internus.
Okay.
So covered by fascia.
Yes, obturator fascia.
Coccygeus.
Coccygeus
Okay.
and piriformis.
Piriformis not part.
Oh, it's not the diaphragm.
Okay.
It's on the back.
It's a pelvic wall.
It's pelvic wall.
Doctor here, can you point that?
Yes. See this all muscular structure. This is all piriformis. Where is piriformis? Here is piriformis. Going like this. It's a lateral rotator of hip. Piriformis. Okay. It's the key of the gluteal region. Oh, good. Thank you. Jazakallah.
We can
Okay.
just see the piriformis here. No other.
Actually, this is piriformis. This all
these.
piriformis area.
Here the elevator.
Where the where the piriformis is going from here. Here, see. This is piriformis, and here is piriformis, like here. Here is piriformis. From here, it will get out. So here you can see piriformis getting out, and sciatic nerve is related to the lower border of piriformis. We must have another one. This is a beautiful piriformis here. Okay, this is a piriformis. This is piriformis. Yes, this we left. We have here promontory. Okay, here we have symphysis pubis. Here we have, okay, levator and eye. Good.
Yes.
Coccygeus. Good.
Yes.
Obturator internus.
Can I see?
Yes, the key. Obturator internus.
The white line is clear, right? You can see it.
It should be clear in. Yes, exactly. Here. Rather, and here is the, see, now the pointer is in the piriformis, and you can see the lumbosacral plexus in front of. Understand? Good? Piriformis, you can see on the back also. Here is the piriformis. This one. More clear in this picture. Okay, piriformis. Piriformis is the key to the gluteal region. This is gluteal region. Okay? Piriformis is the key to gluteal region. If you identify piriformis above superior gluteal structures, inferior gluteal structures, especially the sciatic nerve, the thickest nerve in the body. Thank you very much. Yes, it's finished.